dear colleagues. My name is Anastasya Lapshyna. I'm aesthetic doctor and KOL of Innoaesthetics laboratory. Today we will have with you really very interesting webinar about exosomes. I'm sure that you've already noticed that exosomes are becoming more and more popular. We are using exosomes more and more in our professional treatments. So today we will discuss what kind of exosomes you can find on the market. What is the main difference between all these exosomes, advantages and disadvantages, and of course we will discuss product INNO-EXOMA, which is the innovative product of Innoaesthetics laboratory. We will also discuss how you can use it and how you can achieve really great results using INNO-EXOMA. So first of all, I would like to discuss the general information about the exosomes. So what is that vesicle, how it can be released by the cells, what are the main functions, and so on. First of all, I would like to show you a short video about the basic information of the exosomes and how it works.
We have got the key to a new horizon. Horizon in skin regeneration. We will be the messengers that tell your skin to produce more collagen, elastin, and hyaluronic acid to produce youth. We will be the messengers that will tell your skin cells not to age. Exosomes are cell vesicles that transport information to other cells. This information acts as guidelines for the recipient cell. By carrying the right information, exosomes have extraordinary regenerative properties. They're extensively used in medicine for regenerative purposes. But what if we can also use exosomes in aesthetic medicine? To that end, our R&D department has been working for years on developing an innovative ingredient that possesses properties and a mechanism of action akin to exosomes. An exosome-like nanoparticle that effectively stimulates the synthesis of growth factors and promotes tissue regeneration. Only one vial of INNO-EXOMA contains millions of our exosome-like nanoparticles, granting it an extraordinary regenerating capacity. INNO-EXOMA, a new approach to facial rejuvenation based on exomes.
So first of all, talking about exosomes, it's really interesting that they were found really a lot of years ago, around 50 years ago. They were found, and at that moment the scientists didn't know what is that. So the first idea is that the exosomes are maybe some vesicles containing products of metabolism or maybe some toxins. So it looked like something that was released by the cell that the cell already doesn't need, for example. But of course, later, the scientists understood that it was not like that the exosome is actually like the small copy of the cell, and that the cells used and released the exosomes for the intercellular communication. And the exosomes started to be used in the medicine, first in, of course, not in the aesthetic medicine. It's only last several years we are talking more and more in the exosomes in aesthetic medicine, but before they were used in the classic medicine. Also, I will show you for what indications the exosomes could be used. So the main function of the exosomes is the intercellular communication. So when we need to send some messages or signals to the other cell, the donor cell will release the exosomes that can transport different kind of information. Usually when we need to explain, for example, to our patients what are exosomes, because not all of them understand what is really that. Some of them think that these are some cells, some of them think that these are stem cells, and so on, but it's not like that, of course. So that's why, in order to explain it in a very easy way, we usually compare the exosomes with the letters. So, for example, if I'm going to send someone a letter, I will put my message to the envelope. So the same as with the exosome. Inside the membrane, we have specific information, and the membrane is like the envelope. It is also very specific. So, for example, if I'm going to send someone a letter, I will write to whom I'm sending that letter. The same with the exosomes. There would be specific markers on the membrane of the exosome that this kind of message would be really targeted, so we can influence specific cells. And vice versa. I also have to write who am I, from whom is that message. So the same will be with exosomes, because they will depend on the donor cell. So what kind of cell released the exosome, also we can understand from the markers on the membrane. So actually it works like a really targeted system for sending different messages. And the main properties of the exosomes would be stimulation of the regeneration, restoration, regulation of inflammation, some angiogenic effects, and so on. And of course, understanding all the properties, we understand that really we can achieve great results by using exosomes also in aesthetic medicine. The source of the exosome can be any cell of the body. So if we are talking about human-derived exosomes, usually these are the exosomes which are isolated from the mesenchymal stem cells. And we can get it from different kinds of tissues, from adipose tissue, from umbilical cord, from bone marrow, dental pulp, and so on. But of course, it's much more easier to get the exosomes from the adipose tissue, because such kind of treatment or such kind of procedure is not difficult. We can get really a big amount of adipose tissue. It's like an easy procedure. So how we can obtain that? First of all, we have to take some amount of fat from the donor. From that fat, we will get a stromal vascular fraction, from which we are getting mesenchymal stem cells. And then after 21 days after the proliferation of these cells, they will start to release exosomes. And we already, due to centrifugation, can obtain the exosomes. So this is really the process of getting the mesenchymal stem cells exosomes, but how we can use that in aesthetic medicine? We understand that this situation is possible only in the case if the donor is a patient. So I can't take the exosomes from another person and inject it to the patient. I need to take the fat from the patient and then to inject to that patient the exosomes. But of course, we understand that it's not so easy. So it needed specific certification of the clinic, needed specific laboratory, and also the expenses. So the cost of that treatment would be extremely high. That's why in aesthetic market, really human-derived exosomes we are mostly not using for some transdermal delivery, for example, because with the exosomes there can be a certain risk of the transportation of the genetic information, for example. That's why this is like not an easy option. Let's also pay attention to the biogenesis of the exosome, because it will also explain all the structure of the exosome and really explains how it's important to understand from what cell we obtained the exosome and from which environment the cell was taken. So here you can see a cell, and all the process of synthesis of the exosome, of releasing of the exosome, will start from the process of invagination. So as you can see here, there is an invagination of the cell's membrane, and already some substances from the environment of the cell will get inside, and we will get, like we call it, temporal endosome. Then of the temporal endosome will start to formate the multivesicular body, and already will happen the process of invagination of this membrane of the multivesicular body, absorbing some substances from inside the cell. And only after will be the process of exocytosis. So actually we understand that the membrane of the exosome is the part, if we will pay attention here, is the part of the membrane of the cell. And those substances which we have inside the exosomes will be taken from the cell and also from the environment of the cell. That's why it's so crucial. Did we take a healthy cell? From which kind of environment did we take that cell? Was it an area with trauma, with inflammation? Because depending on that, we will have the specific messages that we will get using the exosome. So that's why, of course, it's so crucial to understand who was the donor, what kind of cell was that, and products with the human-derived exosomes should be certified like the biological material, biological product. So it's not cosmetics, it's not medical devices, it's not medicine. This is biological product. To get the certification like a biological product, of course, a lot of clinical studies and trials and checks should be conducted to be sure that this is completely safe. That's why those kind of exosomes, human-derived exosomes, can be injected or used somehow like injections. There are some, but not in the aesthetic market. So here we are talking about the exosomes which are used for the treatment of very serious diseases like oncological diseases, neurodegenerative diseases, and so on. And this is, of course, because of all that ingredients, of all that substances that the exosome can have inside. Because actually inside can be everything. That can be proteins, peptides, amino acid, nucleic acid, and some genetic information. There can be some lipids. So actually almost everything can be transferred with the help of the exosomes. Also DNA, RNA. So that's why using of human-derived exosomes is always a risk of transporting some information that we are not going to use, or to having some stimuli or stimulation that we are not interested in. That's why what we can find on the market, that was just the basic information about the human-derived exosomes. But what we can see on the market, first of all, talking about human-derived exosomes, how they can be used. They can be used like a diagnostic tool for the diagnosis of some specific diseases, again, like oncology, for example. This is called liquid biopsies. And the principles of the liquid biopsies is when obtaining some quantity of the liquid, so not part of the tissue, not cells, just the liquid, and then searching for the specific exosomes in that liquid, understanding already what kind of cells were producing that. So in this way can be diagnosed some oncological diseases, for example. This is not aesthetic market. This is again the products which are certified like the biological product. Also can be used really naturally derived exosomes for the therapeutic use. So as they possess anti-inflammatory properties, we can take human-derived exosomes, inject that, but in what case? Just in case if the patient was the donor. This is the slide which I've already showed you. So now we understand that it's possible to use, but again with the specific procedure and with the specific certification of such kind of a product. Or also there are modified exosomes. So the exosomes which were naturally derived, if we will get rid of all the information which was inside and we will use just the membrane of the exosome, because the membrane is very specific. It has markers, so it can influence specific cells. Then in this case, inside the exosome, we can put inside this vesicle, we can put medicine, for example, and we will get really targeted therapy for some neurodegenerative diseases, for some oncological diseases, and so on. But this is not aesthetic medicine. Here you can see some companies which are producing this kind of exosome, are modifying this kind of exosomes. Usually they are based in US. There are some companies in Chile. So these are those exosomes which are used in the medicine for really medical indications. But there are a lot of disadvantages, like the risk of transferring some genetic information and getting some stimulation that we are not looking for. That is why now on the market, you also can see plant-derived exosomes. On one hand, yes, it looks like very safe with the plant-derived exosomes. We don't have any risk of getting any genetic information. But on the other hand, if you will, for example, search for the information about plant-derived exosomes on PubMed, you will find really very few information, because there are really just several articles. And still, it looks like there are more questions than answers, because there is a huge question of biocompatibility of plant-derived exosomes and human cells. So if we are talking about anti-inflammatory properties, then okay, it looks like possible, because there are some plants or extracts of plants which possess anti-inflammatory properties. But will we be able to stimulate really synthesis of collagen, of our own hyaluronic acid, getting some effect of angiogenesis and so on? This is a really big question. The next question is the toxicity and some allergic reaction. So of course, human-derived exosomes would be the most natural for our body that can be, because we have it already in our body. But if we are talking about the exosomes of mammalians or about plant-derived exosomes, this is something that is not very common for our body. So it means that we can get some adverse reactions, unexpected reactions, like allergic reaction, some irritations, and so on. There are really not enough clinical studies. Everything that you can find about the plant-derived exosomes is that the trials were conducted with animals, with the oral intake of that exosomes, and we don't have evidence about the injection or using transdermally, for example. Another issue with the plant-derived exosome is that there are no regulations for the manufacturing of these exosomes. So actually every company is doing that with their own process, which usually they are not explaining. If you will ask, for example, how you count exosomes, because you can see that on the vials, in the brochures, there is information about the billions of exosomes in the vial. But if you will ask how you count it, no one is explaining, because there are no regulations. Sometimes I'm even not sure that there are exosomes inside, because in the active ingredients, I can see just extract of some plant. So what it means that we suppose that there should be exosomes in the extract, but we don't know for sure if it's inside. Also, you can pay attention that, for example, when you see plant-derived exosomes, usually they are together, like a vial of the exosomes together with the vial of the product for the reconstitution. And in that product for reconstitution, you can find everything: peptides, amino acids, hyaluronic acid, and so on. So then my question is, so what is working? These plant-derived exosomes or the solution which I use for the reconstitution? That's why still we need more evidence, we need more regulations about the extraction of plant-derived exosomes in order to understand if it's really working. So the main questions are allergic reaction, possibility of toxicity, really low biocompatibility, and some reactions that we can get. So taking into consideration all that issues with the human-derived exosomes, with the plant-derived, mammalian-derived exosomes, Innoaesthetics Laboratory created their own innovative product with the help of NARBEX biotechnology, INNO-EXOMA EXO-SKIN. And this is 100% synthetic product without any ingredients of plant or animal origin or human origin. So this is non-animal regenerative bioengineering exosome. Actually, this is the copy or replica of the human-derived exosome, but replica which was created in the laboratory. So we can say that this is exosome-like product created in the laboratory, synthetic. This is also something that we have to understand, that mostly all the ingredients that we are using, for example, for mesotherapy, like vitamins, peptides, they're all they were synthesized in the laboratory. They are synthetic. We are not using natural ones. So this is something we are common to work with. And of course, the main function of these exosomes would be also intercellular communication. So what is NARBEX technology? Actually, NARBEX technology gives the opportunity to create, with the help of peptides, to create a vesicle, because this is usually also like a common question. Do we really have the particles inside, or just these are only active ingredients? We really have particles inside, and this particle we create due to the NARBEX technology. So inside the product, you can see that there are amino acids and peptides, and due to the changes in pH, because initially at low pH, the peptides have linear structure, but gradually when we will get the pH higher, then these peptides will create the nanosphere. So they will have like a circle building, a circle structure, and inside the structure, which contains peptides, we will have our active ingredients. So maybe the only difference of the human-derived exosomes and INNO-EXOMA is the absence of lipids, but all the proteins we have completely the same, like it would be with the human-derived exosome, but which is crucial, it's not human-derived, it's totally synthetic. So the active ingredients that would be in the exosomes would be signaling peptides, structural peptides, proteins, and amino acids. Actually, this is the main ingredients for the stimulation, and also these are like the building materials for the main proteins like collagen, elastin, which we need for the improvement of the quality of skin. The equivalence that we have, like the quantity that we have inside the vial, would be 200 millions of vesicles. If we reconstitute, like we recommend to reconstitute the exosomes in 2 milliliters of the saline solution that you already have with the exosomes, then in 1 milliliter, by reconstituting that in 2 milliliters, you will get 100,000 exosomes. For 2 milliliters, or in the vial, we have 200,000 of exosomes. Then what is also important? Important the process of lyophilization. So you can see that the exosomes in the vials are lyophilized. That means that we don't have to worry about the process of transportation, about the process of storing that. It's not liquid, because when you have already liquid exosomes, you can keep them with a specific temperature. You also, during the transportation, should be a specific temperature. Here, no. So we just need to reconstitute the product before using, which is very easy, and then you have 24 hours to use that. So inside the exosomes, we have the amino acid necessary for the synthesis of collagen, of elastin, of some very important antioxidants like glutathione, for example. So you can see them here. That would be lysine, proline, glycine, hydroxyproline, and so on. like building material. Also, there are amino acids which we need for the processes of regeneration and restoration. That can be the precursors of melatonin, also histidine, which is essential for the synthesis of filaggrin. And as you know, filaggrin is the protein, the main source of the natural moisturizing factor. Arginine, which is also crucial and needed for the improvement of the regeneration and restoration of the skin, for improvement of the barrier function of the skin. And also there are 5 peptides, which you can see here. Peptides are more difficult molecules. This is actually already the combination of some amino acids. And here we have dipeptide 7 and pentapeptide needed for the stimulation of synthesis of collagen. Here we have also tripeptide 1, important for the stabilization of the dermal matrix. Tetrapeptide 11, which stimulate the growth of the keratinocytes, the turnover, and pentapeptide 5, which will stimulate the growth of the hair. That's why INNO-EXOMA is the product that can be used both for skin treatments and also for trichological treatments when we work with alopecia, or when we just want to stimulate the growth of the hair. So we also can use it for the scalp. Also inside there are histones, which are very, very small proteins responsible for binding of the links of DNA. So in this way, we are obtaining like a kind of epigenetic efficacy. And another epigenetic ingredient would be non-codifying microRNA, which doesn't, of course, it's not codifying, it doesn't have any genetic information, it was synthesized, but at the same time, it possesses epigenetic activity, so we can stimulate the expression of the specific genes. The main mechanism of action is the establishment of the intercellular communication. So we are having a specific message of all that synthesis that I've already explained, and it's already packed inside the vesicle, inside the membrane, which works like targeted system for the transportation of all that active ingredients. So, taking into consideration all the properties of the exosomes, we understand that really there would be a lot of indications and a lot of treatments that we can do with the exosomes. First of all, of course, we can use it for anti-aging treatment because we will improve quality of skin. We can work with the wrinkles, with the sagging skin, and so on. Also, exosomes can be used in the cases of different dermatological pathologies, especially those which are associated with the inflammation. So if you are talking about acne, post-acne scars, some kind of hyperpigmentation, rosacea, dermatosis, dermatitis, then the exosome, due to the anti-inflammatory properties, also will give really very good results. And trichological treatment. So in the case of hair loss, in the case of just the stimulation of hair, if the growth is really very slow, we also can use exosomes. So we have the product which is stabilized due to lyophilization. That is why in the vial you can see like a powder, which you need to reconstitute before using. For the reconstitution, we have 2 milliliters of saline solution, which we add just before the treatment. So in the case you already have a patient on the treatment bed, you can reconstitute the exosomes, and just after the reconstitution, it is ready to use. It's very easy to reconstitute it. You just take saline solution into the syringe. You have 2 milliliters, and you have to put it inside the vial. And after that, mix it gently, not shake it, but gently mixing. Okay, it's ready to use. After the reconstitution, you have 24 hours to use that. The protocol of treatment that is recommended is 3 sessions with 21 days interval. Mostly for most of the patients, that would be enough. But of course, everything will depend on the indications. So in the case of really severe lesions, severe hair loss, sometimes we will need more treatments, but the average quantity are 3 sessions with 21 days interval. This is also that protocol with which we conducted our clinical trials. So I will share with you the results that you can obtain after such kind of treatments, after this protocol. The protocol of treatment is really very easy. So first of all, we disinfect the area where we will use the exosomes, then we reconstitute the product and apply topically or through the transdermal delivery, so you can use it with a microneedling, for example. And we finish the treatment by applying Innoderma skin repair in order to soothe the skin and finish the treatment. So here you can see the application protocol, which is really very easy. Here the depth of the using of microneedling is really very superficial, around 0.2, 0.3 millimeters, because we have a young patient without some severe symptoms of aging. But in the case you are working with a more mature skin, in the case you are working with the post-acne scars, for example, or with the skin with hyperkeratosis, or if you are working with the body, for example, you can use more deeper application. It can be up to 2 millimeters on the body, for example, because we understand that the product is sterile and the product is not of human origin. That's why it's completely safe for such kind of treatments. It's very comfortable for the patient. You can work with all the areas, including delicate area of the periorbital zone. There is no significant irritation or redness during the treatment. Also, as for the techniques, here you can see like stamping technique, but linear technique can be used. Circular technique can be used. Everything already depends on the sensitivity of the skin of the patient. If the skin is thin or vice versa, it's more thick. So after such kind of treatment, we are just waiting for the absorption. Even such superficial treatments will be really very effective, because I will remind that the exosome is really delivery system, targeted delivery system. That's why it will penetrate and it will stimulate the cells, even in the case of superficial application. As you can see, the protocol is very easy, comfortable for the patient. We work with all areas. You can regulate the depth. We are finishing with Innoderma skin repair and also with the sun protection. Trichological treatment is also very easy, so we again working with microneedling, with stamping technique. The depth of using microneedling is around 0.2. So normally we are paying more attention to the problematic areas, but of course we can work with the whole scalp. In this case, this is parietal region, this is hormone-dependent area. That's why mostly we are working here. but also with the scalp in any areas you can additionally work. It can be stamping technique, it can be linear technique. Linear, circle. There's no need to work deeper. So using INNO-EXOMA, we understand that we are using completely safe product, 100% synthetic without any ingredients of the human source, mammalian source or plant origin. Of course, it was produced with the highest standards of GMP of the laboratory, with the huge experience of this laboratory, which is more than 125 years. And before launching the product, of course, we conducted clinical trials with the patients. We are still conducting, like we are doing some other protocols, some other combinations, and so on. But the first clinical trials were conducted just with 3 sessions with 21 days interval with exosomes and saline solution. So here I would like to share with you some results that we obtained that really show what great results you can get after treatment with the exosome. So all the patients that I will show you now, there were 3 sessions with 21 days interval, and already you can see the improvement of the or regulation of the vascularization. And also what is interesting that we obtained really good results in the case of the hyperpigmentation. So you can see that after 3 sessions of application of exosome, we see really lower deposit of the pigment in the superficial layers of the skin. Which is of course due to the decrease of the inflammation, so due to the anti-inflammatory properties. In this patient also, just in the pictures before and after, you can see that the skin, we have more even skin tone, more light skin, less evident pigmentation. Also, we can evaluate it here, that the pigmented spots are not so visible. That's why the exosomes can be a great addition to your protocols of treatment of hyperpigmentation, or sometimes it can be like alternative of the treatment of hyperpigmentation, especially in the cases of the patient who don't have expected results with the peelings, for example. This is also an interesting patient with a scar, but the scar is pigmented, and also pay attention to the lightening effect and the lower deposition of the pigment after the treatment of exosomes. So it really shows us the very, very strong anti-inflammatory properties, because hyperpigmentation, like one of the etiologic factors, is of course the chronic inflammation. In the case of younger patient, what we can notice? We can notice the reduce of the depth of the superficial or mimic wrinkles, and also we can see the reduction of the quantity of the opened pores. So it's more even skin tone. Also more even skin tone, more light skin, less sagging, more firm skin, improvement in the case of mimic wrinkles. So these are really great results, which you already can notice in 3 sessions. Also, I would like to share with you some results which were obtained by the doctors all over the world, because now more and more doctors starting to use INNO-EXOMA, and they are getting really great results. Also, these doctors are sharing their results during the trainings, for example, that we are organizing in different countries, and they are really very happy with the results. So I would like to show it also to you. This is a great result of the treatment of the complication after laser treatment. Post-inflammatory hyperpigmentation. This is the result of the doctor from Dubai, and she achieved this result just in a single session of application of the exosome, which is really great, using microneedling. This is the result of the doctor from New Zealand, and you can see here there were 3 sessions, but the skin tone, less hyperpigmentation, some lifting effect, really much younger skin, better quality of skin, great effect of hydration. Again, New Zealand, the results of treatment of the hands, spectacular, like less of pigmentation. Here is the result from Brazil, improvement of the quality of skin in the perioral area when we are working with the barcodes, for example. So here also more tense skin, more firm skin, some trichological results. So even after 3 sessions, you can see significant improvement in the growth hair. And also look at these amazing results. So here you can see the result just after the 2nd sessions, but in general it was conducted 3 sessions with the interval 2-3 weeks with the microneedling. It was the case of alopecia areata, but the results are really great. So this is something that I very like to share. Also, I'm sure that when you will start to work with the exosomes, maybe you already started, maybe you already have such kind of results. We also can share your results if you will send it to us with mentioning you, of course. If you don't work yet, but you are going to start to work with the exosomes, you will be really satisfied with the results. Your patients really will be happy with the results. And now we are having that more and more. There are also really great results in the treatment of rosacea, especially if that was papulopustular rosacea, for example. I also can recommend you different kind of combinations with the exosomes after some kind of aggressive treatment. So for example, if you're working with microneedling radiofrequency, if you're working with lasers, just after the treatment, you can apply exosomes topically, and that would be a great stimulation of the regeneration, prevention of any kind of complications. So I can say that there are really a lot of indications for using of exosomes, and also you can implement the exosomes to a lot of different treatments that you are already using in your professional portfolio in clinic. That was the main, let's say, basic information and protocol about the exosomes. Please, if you have any questions, you can write them in the chat, and I will answer these questions now. If maybe in a while, when you will start to work with the exosomes, you will have some questions. So later, here you have Skin Academy email that you always can write, and we will send you necessary information. You also can contact with the distributor in your country. All the distributors are always in touch with us, so we will provide you all necessary information. Let me check the chat. I guess we already have some. I guess there were some time issues, the difference of time in different countries. The webinar will be recorded, so you always can watch it on our platform. As for the depths of using microneedling, you can start, for example, for the face, you can start with 0.2, 0.3 millimeters. In the case you are working with the scars, in the case you are working with the body, you're working with the stretch marks or hyperkeratosis skin, then you can work up to 2 millimeters on the body, for example. So it's up to you, depending on the severity of the lesions you are working with. If you're working with a normal skin or sensitive skin or skin with rosacea, for example, prone to irritation, then 0.2, 0.3 would be completely enough. For the microneedling, well, how many needles for microneedling? It depends, of course, on the brand of the microneedling you are using, because with some brands you can use one needle containing, for example, 16 or 24 or 32 needles, and you using just one cartridge during the whole session. Sometimes when you're working with the body, you will need to change your cartridge. So there will be 2 cartridges, but actually the quantity of the needles is not so crucial. It can be 16, 24, depending on the indications and the skin of the patients with which you are working. Is the product safe to use for teenager with pimple, scars, and acne? All the questions about teenagers, pregnant women, women in the period of lactation are a little bit tricky, because no one never conducted any clinical trials with the teenager, with the pregnant women, or during the period of lactation. So this is the first important information to understand. The second is that, of course, when we see the active ingredients, we understand that actually there is nothing that can be contraindicated for the teenager and so on, but it's also depending on the regulations in your country. So, for example, there are countries where you can use for the teenagers, but you just need the agreement from the parents. Also, as for the teenager, I would say that in any case, I would recommend you to start the treatment from home care using acids, of some professional treatments with very superficial peelings like Mondelage, for example, again with the agreement with the parents. But if needed, if you already want to start effective treatment of the post-acne lesions, for example, then it's possible to do, but just with the agreement of the parents. It's just because of the regulations in different countries. The next question, what about the safety in pregnancy? Again, the same which I've already mentioned for teenagers. As for the pregnancy and lactation, what else is important for us to take into consideration? This period is usually the period of the hormonal disbalance, both pregnancy and lactation. And sometimes using really very effective treatments and products and protocols, we are not obtaining the results we are looking for. just because of the response of the organism of the pregnant woman. So my recommendation is always to start such kind of active treatments after that period in order to obtain really good results. And during the period of pregnancy or lactation, we have some alternatives, like we have some really effective home care, which is Epigen, for example. Again, depending on what serum, but still we can work with the patients in a more mild way during the pregnancy. For the face and scalp area, the average depth that I use is usually 0.2 to 0.3 millimeters. Sometimes I use more if the skin is with hyperkeratosis, if there are signs of fibrosis, if there are post-acne scars, I can work deeper. It can be up to 1 millimeter on the face, up to 2 millimeters on the body. If we are talking about using with any kind of devices, of some kind of, let's say, not aggressive, let's say active treatments. So if you are doing laser treatments, if you are doing microneedling radio frequency, for example, exosomes would be a perfect combination with that. For example, I worked with the exosomes just after using Morpheus. This is microneedling radio frequency. So the only difference in the protocols is after laser or after radio frequency microneedling, you apply exosomes just topically. So you don't need to use microneedling in that case because the skin is already traumatized, it's already irritated. So you are using the exosomes topically for the stimulation of regeneration, for the prevention of any kind of side effects, and also for obtaining really much better results as for the stimulation of synthesis of collagen. One vial for one person only, one vial for one area. So usually we say that one area is face and neck. Decollete would be another area. Hands would be another area. I don't know, abdomen would be another area. So we use one vial for one area. This is the active dosage. If you want to work with the several areas, you need several vials. Area around of eyes. Area around of eyes is, of course, not the whole area. The whole area is face with the neck. So if you're working just in the periorbital area, you will need like 1/3 of the vial, even less. But usually we are not working just with the small area. It's better to work with the whole face, because for the improvement of the quality of skin, we need to stimulate synthesis of collagen in all the area, not just in the small spot. What are some of the adverse effects that you can have in using exosomes? As for the using of these kind of exosomes, when we are talking about the synthetic product, which is completely safe without any kind of risks, the adverse reactions can be associated with the technique of the application. So if the technique of the application was chosen wrong, so for example, this is thin skin with rosacea, and we are using microneedling with a depth of 2 millimeters, even of 1 millimeter, for example, with the several layers of passing with the microneedling, then we can get some kind of irritation or redness after the treatment. But it's associated not with the product, it's associated with the technique with which we're using that. This is the only possible adverse reaction that we can expect. Besides microneedling, can exosomes be used at the same time with other technologies like electroporation, electrocurrent, cold plasma, etc.? Yes, you can use also exosome together with all the trans delivery systems. That wouldn't be an issue. During microneedling, shouldn't be blood on the face, just 0.2, 0.3. Well, the blood we can see at the depths of usually 0.3, but also if you have experience of working with different kind of devices for microneedling, I guess you've noticed that the needles, the sharpness, the quality of the needles is different. So for example, when we are using like original microneedling from US, Dermapen, then even on 0.2 millimeters, we can sometimes obtain some blood. And that's okay. It's also okay if you have blood during the treatment. It's not a problem. If you're working with the other kind of devices, there are a lot. They can be Chinese, they can be Korean. Sometimes there may be the difference in the sharpness in the needles, and in order to obtain blood, we need to be deeper. But what is important for you? You have to understand that both superficial application or a bit deeper application with or without blood is effective. Is effective because the exosome by itself is the perfect delivery system. So it will penetrate and it will transport the active ingredients. As remember, like before, for example, I usually use this comparison with the cosmetics when we were talking about liposomes, nanosomes, and everything. The difference was that we are using the same ingredients, but we pack them in a specific way. The same with the exosomes. The ingredients, you've already worked with that. You worked with the amino acids, with the peptides, but here we have first specific ingredients and they are packed in the targeted delivery system, which will be effective even in the case of topical use. That's why even if you're working with a patient with damaged skin, with dehydrated skin, with the skin prone to allergy, for example, you also can use exosomes topically and they will work perfectly well. You can work really very close to the eyes, in all the area of the eyelids. The only exception would be the moving part of the upper eyelid. Of course, mostly we don't work with that area because this area is prone to puffiness, swelling. So if you need, you can apply it topically. Again, here you can work very close to the in all the area of the eyelids, but close to the lashes. If you don't want to work with the microneedling in that area, maybe because it's very sensitive, very delicate area, patient with weak capillaries, no problem, add it topically in that area. Has there been any reported events of allergy to exosomes? I don't know about any, so our distributors, and we already work for some period with the exosomes, we didn't have any reported events of the allergy to these exosomes. That's why, of course, we understand that the reaction of the body and some kind of allergic reaction is possible. It's very individual. But for this product, we didn't get any reports. So as for the tests, is a skin test or patch test encouraged? Well, personally, I don't recommend to do any kind of tests just because mostly it doesn't have any sense. Almost doesn't have any sense. So if you really working with a patient who has episodes of really severe allergy in anamnesis, then you can conduct maybe just a patch test. But what is the problem? The problem is for the first time when you are applying anything, exosomes, vitamin C, peptide, it can be any ingredient, and you are doing like or injecting that or doing the patch test or something like that, the moment of the first contact with that ingredient, the body will not react. It will react on the second contact when already will have the activation of the immune system, because already after your test, it will recognize the ingredient. So actually, almost there is no sense in doing that. But I didn't hear, me personally, I didn't get any allergic reactions. And since we started to work with that, now a lot of doctors all over the world are already using. I'm talking with the doctors during the trainings in different countries, and I didn't hear about any adverse reactions like allergy. How many passes to do with microneedling? I do 4 on each zone. For example, I usually do 2 passes in the same region. As for me, that's enough. And you can evaluate depending on the patient. Maybe you are working with the more mature skin, maybe you are working with the patients with the more thick skin. Then it can be 4 passes, but 4 passes will give you more effect with the microneedling, with the needles, I mean. So there is sense to do more passes if you are expecting to obtain some results from the microneedling. The exosomes, for the exosomes, it doesn't matter. Even if you will do 1 pass, and as I've already mentioned, even if you will apply it topically, it will work. Just combination of the exosomes with the microneedling, for us, it's like the combination of the positive and negative stimulation. Exosomes like positive stimulation because we are giving some substance which will stimulate. Needles are like negative stimulation because we are creating trauma. We are looking for some effect of pro-inflammatory effect, activation of some growth factors. So this is the balance of both kinds of stimulation, positive and negative stimulation. But with the exosomes, you also will obtain the results even with smaller quantity of passes or just topically. Any other questions, please, you can write in the chat. Can heat change the structure of exosome? Well, it depends what heat. That's why when we reconstitute the product, we recommend to keep it not more than 24 hours and in the room temperature. So that's why from laser, we are talking about using the exosomes after laser treatment. So everything which I was telling with the combination with radio frequency, with the laser and so on, I recommend first to do the treatment, and after, like finishing the treatment, you can apply exosomes. You can have the recording of this webinar on the platform, so you can see it. Maximum how many sessions we can do for clients 70 plus and 55 plus. There is no, let's say, limits, but the other question is really, does it make any sense to do that for too many sessions? That's why I can say that mostly for your patients, for most of your patients, 3 sessions would be enough, because I shared with you all the results that we obtained with 3 sessions. If in the case of 70 plus, for example, that obviously would be needed more sessions, and that could be up to 6, I would say. I don't think there is the sense to do it more, because also the stimulation is not something eternal. We have some limits of the production of the collagen, of the stimulating the fibroblasts. That's why in that case, I can say that the most intensive treatments, that would be 5-6 sessions. Also in the case of, for example, severe traumatological issues, there would be some patients who would need more than 3 sessions, and that can be up to 6. Is it good to make a peeling before? That's depending on the patient. So you have to understand why you are doing peeling, why you are doing exosomes. If, for example, if you're working with really sensitive skin, or you're working with some dermatosis, skin prone to dermatitis and so on, then you are looking just for the effect, anti-inflammatory effect, and that gives you exosomes. So in that case, like, there is no much sense to do some peeling with pro-inflammatory properties. And other situations. So if you're working with the post-acne scars, which already exist for a lot of years at this patient, so then of course, just to stimulate synthesis of collagen would not be enough. Here we need some also negative stimulation. So we can combine then exosomes together with some kind of peelings. But it's very individual, depending on the skin of the patient and depending on the problem with which you're working. And then you can evaluate. But actually, there are really a lot of possibilities how to combine with other different treatments, with peelings, with mesotherapy. Also, we are getting a lot of questions regarding reconstitution with TDS products. That is also possible, by the way. So, but there should be sense in the reconstitution in TDS. For example, like, can we reconstitute exosomes with, let's say, DNA peptide? We can, but what would be the sense if I already have peptides inside the exosomes, amino acid? Why would I use DNA peptide? But in the case when you want to have, for example, you're working with rosacea and you have cupirosis, so additionally with the exosomes, you would like to obtain some results of the strengthening of the walls of capillaries, then of course you can add redness ID. Or in the case of androgenic alopecia, we understand that just the stimulation with the peptide that we have in the exosomes in the case of androgenic alopecia would not be enough. We need some inhibitors of 5-alpha reductase. So in that case, we combine with hair loss control, for example, which contains the inhibitors of 5-alpha reductase. So such kind of combinations are possible. You just need to understand what are the indications that you are using for, and then you are creating some protocols. We repeat this treatment. So the basic protocol, which is recommended, is 3 sessions with 21 days interval, once or twice a year. So usually once a year, you are performing this treatment for those patients who have regular treatments, who have really good home care, with whom you are working during the whole year. If this is the patient which really need maintenance because not using sun protection, love sunbathing, and so on, in that case, in the damaged skin, dehydrated skin, it can be done 2 times a year. So if you will have more questions, again, you can contact with the Skin Academy. You can contact with your distributors, who can contact them with the Skin Academy, and we will provide all necessary information. Thank you very much for your time. I'm sure that you will be really happy with the results of the exosomes, so I really recommend you to start this treatment already to obtain good results to help your patients. And I wish you a great evening. Thank you very much. Bye-bye.